Okay, breaking news. All right, what about Prilosec? Prilosec, omeprazole, Nexium, those drugs are one of the group of most prescribed drugs in the world. You know that they're popular because they're being advertised on primetime TV, you know, the purple pill and Prevacid and things like that. You can't advertise on TV unless you're a multi-million-dollar business, and those drugs are multi-million-dollar businesses. Lots of people are taking it for GERD, gastroesophageal reflux disease, and many of those patients are on it for life. Their gastroenterologist says, here's the omeprazole, Prilosec, Prevacid, Acifex, and I want you to take it forever. Take that forever, for life, okay? And people up until recently thought that was a pretty safe thing to do because they couldn't find any complications. Recently they found if you take Prilosec forever, for years and years, they found a few complications can happen. One is, when you cut down the acid, you may let a bad bacteria called Clostridia difficile grow. It's rare, but it's a dangerous bacteria, and so some people are worried about that. There's also an interaction with a heart disease medicine called Plavix. Plavix helps block platelets from clumping, causing heart attack and stroke, and so Prilosec may block that blocker and may increase the risk of heart attack in heart patients slightly. Finally, if you take the Prilosec forever, it may lower the acid in your stomach, and it may decrease your ability to digest and absorb calcium, and long-term there may be a slight increased risk in osteoporosis. So we're coming up with new recommendations on the Prilosec, which is maybe you don't need to take them forever. So we say take them for the first anywhere from 3 months to a year, and after that stop it and see what happens. We do think there'll probably be some people who need it forever, but if you don't. That's the new research. There is some long-term risk now showing up, very slight, in taking Prilosec forever. And the things are osteoporosis, C. diff or Clostridia difficile infection, and the interference with Plavix. So our new recommendations are maybe you don't have to take it forever. Most of our patients do not get ulcers, although some do. And so we use it as a prophylactic or prevention mechanism for the first 3 months to a year. And after that, maybe stop it.
Okay.
So good question.
And then I just have one more thing to say.